There's something that, of course, we want to make sure we are always aware of for our loved ones who are of advanced age, but also for yourself, and that's Alzheimer's disease. Some of the stats and how we can detect it, we'll now talk here with Springfield's Morning News on 92.7 WMAY. Springfield's News and Talk, Dr. Tracey Smith. She's Director of Community Health with the Illinois Public Health Association. She joins us now to talk about this. Doctor, thanks for taking time with us this morning on WMAY. How you doing out there?
I'm doing well, thank you, and good morning.
Good morning. This issue came to light on entertainment stage after actor Chris Hemsworth apparently took some kind of genetic test to determine he had a genetic issue which could lead to Alzheimer's. Talk a bit about that if you can, and are those tests widely available, or how can the public listening right now determine if they have a proclivity towards Alzheimer's?
So genetic testing is available, but there's other ways to detect Alzheimer's disease. And so, again, the key thing is to get connected with your primary care provider and discuss the warning signs, the potential symptoms of Alzheimer's, so that together, being informed from your primary care provider allows you to make the choice whether genetic testing is the direction that you need to go, or is there some other direction or something else that may be causing some of those signs and symptoms?
So obviously talking to your primary care physician and they can give you some answers and maybe even put you in touch with some specialists who deal with this. Obviously we want people to understand that they have those avenues to get the information they need and to get the help they need. But for people who aren't familiar with Alzheimer's, we hear the term thrown around. What is it? What are some of the symptoms people need to be watchful for?
Yeah, so Alzheimer's disease is a degenerative disease caused by brain cell damage. And it's where plaque builds up between the brain cells, and that causes a breakdown in memory and basic motor function. When we talk about Alzheimer's, we talk about the 10 warning signs of Alzheimer's. So I'll list those out for individuals who can kind of hear those and stop and think about it as you're seeing your loved ones over the holidays, or if you're noting some of these in your own self. It's a great time to have that discussion with your provider. So memory loss that disrupts daily life, difficulty completing familiar tasks, trouble understanding visual images and spatial relationships, new problems with spoken or written language, changes in mood or personality, challenges planning or solving problems, confusion with time or place, misplacing things and losing the ability to retrace steps, decreased or poor judgment, and withdrawal from work or social activities. So, my father had Alzheimer's disease, and probably the first thing that we really noticed with him was he was a farmer, and he started to have difficulty completing familiar tasks, such as the work he was doing on the farm. And so kind of thinking about, you may not see all of these warning signs, but there may be something that stands out, and you're like, boy, that's just not like my dad or my grandpa or someone else that I love or I know.
We're talking with Dr. Tracey Smith. She's with the Illinois Public Health Association, and the topic is Alzheimer's. Doctor, what's the difference between Alzheimer's and dementia?
So dementia is a general term that refers to declined mental ability. So there are multiple causes for dementia. Alzheimer's disease is a particular disease that is a degenerative disease caused by that brain cell damage. So, if you think about dementia, is kind of like that umbrella word, right? And then Alzheimer's is one form of that underneath that umbrella.
Gotcha. So again, when it comes to Alzheimer's, talk to your primary care physicians, make sure that you know the warning signs, but also, as we talked with at the beginning, actor Chris Hemsworth taking that genetic test. If you do get back that you have a predisposition of sorts to Alzheimer's, what are some things people can do now at a younger age to possibly brace for what they might have to deal with at an older age? And when would that onset be?
And that's a great question. There's still a lot of unknowns, and getting a genetic testing such as what Chris did does not necessarily mean that he's going to get Alzheimer's. It's not causation related, but it does tell us that you have potential risks, right? So if you want to know more information, we have set up a website. It's called Know Alz, KNOWALZ-Illinois.org. Illinois.org. And a lot of that information will be provided there. But in terms of what your question is, we really don't have a cure for Alzheimer's disease, but we are having so many medical advances that have presented new treatments, and we know that certain lifestyles can help extend the time with those who have it with their memories. And so we can extend that period of time. Studies have linked better diet, exercise, smoking cessation to slower progression and decreased risk for Alzheimer's disease. And the key thing, again, like I said, is to get connected to your primary care provider, those specialists. There's the Alzheimer's Association in the state of Illinois, which does a wonderful job. And all of that kind of information can be found at that website, knowalz-illinois.org.
Dr. Tracey Smith with us here with Springfield's Morning News, talking about Alzheimer's and how you can know the warning signs and get more information. Again, the website is knowalz-il.org, knowalz-il.org, and you'll be able to get more information. But for those who have loved ones already suffering from Alzheimer's, how can they best make those interactions, those day-to-day interactions with their loved ones, fruitful, positive, and ensuring that they have that relationship intact?
It's making sure that you stay in touch, right? Making sure people are safe. This is one of the biggest risks, that we want to make sure that everybody is safe, but also helping with those needed things. So if they're forgetting words, allow that to happen, but help them to be able to complete whatever task they're doing. Be understanding that this is a disease process. This is not their fault. It's not the fault of someone else. And really just continue to love and care for that person. That's really critical. Making sure that they're eating and getting the hydration that they need, because in the later stages, that's something that is often forgotten, or not something that continues to be driven as much by the individual themselves. So all of those things are really critical. And again, at that website, you can find a lot of information to assist with that process.
Dr. Tracey Smith, greatly appreciate you taking the time. This is an important issue because the stats are pretty staggering as to the number of people that could be diagnosed with Alzheimer's. Do you have that stat in front of you? Because it's like 1 in 9 people could have a diagnosis?
Right now, one in every 9 adults age 65 and older have been diagnosed with Alzheimer's disease. So we're not talking about something that isn't affecting very many people. This is something we really need to be concerned about in a public health arena. And that's why at Illinois Public Health Association, we are really developing new programs, utilizing community health workers to help get information out there, help individuals to navigate to primary care providers, and find out that information that can give them the power back during this disease process with their loved ones.
Well, Dr. Tracey Smith, the Illinois Public Health Association, greatly appreciate you taking the time, and let's connect again soon on this and other issues, all right?
Thank you very much, Greg, and have a great day.
You too. It is Springfield's Morning News on 92.7 WMAY, Springfield's News and